Hi guys, it's Dr. Hardy, your pediatric obesity expert. Thank you for tuning in. Today I want to go over another Pediatric News Brief article. I have the same newspaper, Pediatric News, endorsed by the AAP, and this particular article is entitled Pediatric Fractures Shift During the COVID-19 Pandemic. And basically what they're saying, they're seeing a change in childhood injuries because of the pandemic. And can you guess why? I would guess that since kids are staying home, they're not outdoors as much. There's probably a decrease in the number of fractures in kids. And indeed, this article supports that somewhat. So what they're saying is that although fractures have decreased because they aren't out running around like before, but to their surprise, injuries are increasing in the home. So that makes sense. They're at home more, they're playing indoors more, and the injuries are going to occur in the house more. So let's read a little excerpt here. It says, we expected to see a drop in fracture volume, meaning the number of kids coming into the hospital with fractures, but what was a bit unexpected was the proportional rise in at-home injuries. As time went on, it became more apparent that trampoline and bicycle injuries were on the rise. So what is everybody doing? Because their kids are at home and they can't go out and play with their friends, they're buying trampolines and putting them in the backyards, right? So let's see, as noted, because of the pandemic, a higher proportion of pediatric fractures occurred at home. Data suggests that in more recent months, kids are presenting with fractures late. So why do you think they're presenting to the hospital late? I can also guess that maybe parents don't have access to the hospitals like before. They may not have a job. They may have lost their job from COVID. They may not have transportation or money because they lost their job to get to the doctor's office or to the emergency room. And so they are delaying seeking care. So let's see what this says. What has changed is that a lot of adults have lost their jobs, and as a consequence, a lot of children have lost their access to private insurance. So I didn't think of the insurance issue. Well, it's all related. I thought about, they don't have money to get there. Well, if they don't have the job, they lost their job, their health insurance through their jobs. And so now they are more reluctant to go to the hospital. So they're probably like, let's see if Johnny starts to feel better over the next couple days. Maybe it's not broken. Maybe we can just see and give it some time to heal, as opposed to being more hyper vigilant about seeing the doctor. The last thing they mention here is that Velcro splints are being used more often, or being, now that they're trying to streamline care of these kids and get them in and out, or there might be more televisits for follow-up and things like that. So doctors are changing the way that they care for pediatric patients. And with these injuries, they are now using more Velcro splints than casting. So they want to get these kids in and out of the ER, and they're using these Velcro splints. And there have been studies that showed that there wasn't a significant difference between using Velcro splints and casting, and they were trying to change doctors' behavior and management with these fractures, and it seems like there was some reluctancy to do so. But the article implies that as doctors use more Velcro splints, and these primary care physicians see that their patients are actually doing really well in the Velcro splints, that this will change their mind and their perspective on the Velcro splints versus casting, and it may become the norm. So I thought that was pretty cool. Well guys, if you like this information, don't forget, tap that notification bell, tap that subscribe, so you will be notified when I've uploaded a new video, and hopefully another pediatric news brief.